Good morning, everybody. On behalf of TIC management and staff, a very warm welcome to all our clients and colleagues joining us today. We hope you enjoyed the video celebrating our planet and all the fabulous destinations we'll be able to visit as soon as international travel opens again. I felt quite emotional. My name is Simi and I'm on the sales team at TIC. And I'm super excited to welcome you all as Dr. Albie De Frey shares with us his involvement in the repatriation and quarantine of South Africans during lockdown. Now, lockdown happened to everyone all of a sudden when we were just getting along with what we get along with every day. It really was a bit of a whirlwind, and in reflecting, I looked at the timeline and it was late December, whilst we were celebrating our holidays, that Wuhan informed the regional WHO office of a pneumonia outbreak. And the cause was unknown. Most of the cases, you'll remember, had emerged out of the seafood market, and everyone was told to stay indoors and wear masks. This was late December. And then quite a lot happened in January when we'd all started to embark on our New Year's resolution. They closed the market, and now China was reporting that the pneumonia outbreak was caused by a new strain of the coronavirus. And they said that this virus belonged to the same family as the SARS virus and the common cold. And I remember thinking, okay, we've experienced SARS and the avian flu. It's going to be okay. So far, I felt that Ebola was much more scary. At the same time, the first case outside of China was reported in Thailand. It was a resident from Wuhan who had traveled to Thailand. And now the travel alarm bells started ringing. Then, and I'm still in January, China places 3 cities, including Wuhan, under quarantine, affecting millions of people. Now, I'm an insurance and a just in case kind of person. So at this point, I started honestly feeling that just in case, perhaps it was a good idea to stock up on masks and gloves, which I did. And I bought masks when they were 10 Rand 99 for a pack of 10. By the end of January, the World Health Organization had declared COVID-19 a global emergency. It was 6 weeks later, at the beginning of March, that the first confirmed case of coronavirus was reported in our country. It was a chap from KZN who had traveled to Italy as part of a group. And by then, Italy was blazing. 2 weeks later, our president declared a national state of disaster, and a week later, it was announced that we would go into lockdown beginning the 27th of March, including a ban on international travel. And while we were all running around like headless chickens to get organized, thousands of South Africans were stranded in foreign countries around the world. Many South Africans have been repatriated since, and many of you joining us today who have assisted the travelers in some of the repatriations are aware of the complicated process to bring the travelers back home safely. So it is a great pleasure for me to introduce our speaker today, who's going to talk to us about his involvement in the repatriation and quarantine of South Africans stranded internationally, as well as a bit of what he usually gets up to. If you have any questions during the session, type them up in the little Q&A box at the bottom of your screen, and we'll try to get to them before the end of the session. But if not, don't panic. We will reply to all the questions separately after the session. Some of you joining us today met Dr. De Frey when he accompanied us on the lovely roadshows we did around the country in 2018 about travel and health risk management. But Dr. De Frey obtained his medical degree in 1983. Dr. Albie, that was a year after I matriculated. And he began his career in travel medicine in 1992, where he started jetting around the world, fetching sick and injured people in air ambulances. Dr. De Frey is a senior honorary lecturer at the School of Public Health, as well as Faculty of Health Sciences at University of Witwatersrand. He was instrumental in developing the WITS Travel Medicine course in conjunction with the James Cook University in Australia. He's a member of the WHO expert roster on travel health in Geneva. He's a founding member of Travel Doctor Corporate. Now, this organization offers integrated occupational and travel health services to corporate. He's the director of Travel Doctor South Africa for regular guys like us, any traveler who needs pre-travel medical preparation like vaccines and malaria prophylaxis. And he is the medical director of the International Health Management Consultants in Geneva, who busy themselves with remote site medical services for mining and construction industry. So, Dr. De Frey, it is now over to you. Are you armed and ready with water and electricity?
Right. Share. Good morning, everybody. I think I'm on air now. Is that correct? Can you hear me, Simi? All good?
Yes, we can, Dr. De Frey.
Perfect. Right. And you can see my screen?
Yes, we can, Dr. De Frey.
Great. So, Simi, thank you very much for that introduction. I share your feelings about the video. I didn't see it beforehand either, and I also became quite emotional, but that's not too difficult these days. Being slightly more senior these days, I cry every time they open a new ShopRite Checkers down the road. So, but yeah, it did certainly remind about many wonderful places that I've had the privilege to visit, and the places that we would like to go. So today's talk is, as you said, a little bit about the quarantine process, but the good news is that things are moving so fast in this epidemic that we can actually start looking forward to the idea of traveling again. And so I'm gonna put a little bit of emphasis on that as well. And I want to start off by just a few reminders of exactly what you said is the things that we normally busy ourselves with. So let's talk about the ins and outs of travel in 2020. And I want to start off because there was a bit of a pessimism around saying, well, nobody can go anywhere. But since we've changed lockdown levels and we've been allowed to travel for business, for study, and for medical reasons, I can tell you the travel is alive and well and happening. And the areas that are circled on the map of Africa that you can see right now are the focus areas that we've been involved in for many years, but where I can assure you that there's a lot of work activity, mainly mining and construction going on. South Africans are very, very involved in that. And it was a feeling that we seriously needed to get back to work, not only inside the country, but that there are hundreds, if not thousands of South Africans that are dependent on their livelihoods for working in the areas circled here in the mining and construction industry, and a need to rotate people out that were stuck in those countries in lockdown, people that normally work for 6 weeks and come back home for 3 weeks and then go and work again, have been stuck in West Africa, East Africa, and other places like the DRC for as long as 4 months. And they desperately needed to come back. They couldn't come back unless there was a relief crew to relieve them. And so there was a need for them, there was a need for travel in the absence of regular commercial flights. So that's how we got involved. So I quickly took a snapshot this morning of Flight Radar. And this is what Africa looks like. And I think this is a bit how most of us feel. We know that there are local flights happening now. You can see the flights between Cape Town and Johannesburg. But by and large, we tend to feel that the world has come to a standstill. But that's not quite true. Look what's happening in Europe this morning. Pretty busy. People are traveling, and that's just a snapshot towards the east. I didn't put in America because they're still sleeping. So there is life out there. Travel is happening. And all of us involved in the travel industry in some way or another need to be prepared for that and wake up and smell the roses. I'm not going to dwell on this slide because Simi basically already said Travel Doctor Corporate, we take care of expatriates and frequent travelers in the corporate environment, working people. Travel Doctor is there for walk-in travelers, people that just love to travel for work or travel for leisure. And then International Health Management Consultants based out of Geneva is involved with remote site medical support. And that's really how, as I've just explained to you, we got involved with the repatriation flights. That's just our office in our clinic in Rosebank. So that was a little bit about who we are, and those are the topics we're going to cover. So I've got to go back to travel in a nutshell. We addressed this at length when we toured the country, as Simi said, 2 years ago. Wonderful trips, wonderful people we met, very interesting questions. So in the environment of COVID, the coronavirus, the bat flu, we still have to remember that the normal travel health risks, the things we used to fret about in the past, they are still out there. So your basic lesson in travel health, just revised, you bite into it, it bites into you and it hits you. You bite into it is so-called food and waterborne disease, traveler's diarrhea, hepatitis A, typhoid, Lassa fever. It bites into you as malaria, yellow fever, rabies, sleeping sickness, dengue, etc., etc., and it hits you is trauma, the things that we can't really do something about in a travel clinic environment, but which the health and safety people and you personally are responsible for: wearing your seatbelt, not driving at night in developing countries, wearing your seatbelt, etc. So those things have not gone away, and they are still as important as they were before. Pre-travel preparation is not about getting vaccinated. It's about education. It's about reminding people about the things that they need to do for themselves. If I give you every vaccine in the clinic, which I would love to give you right now because they're all expiring, it would only protect you against approximately 5% of travel-related diseases, which is not to say that you mustn't go without them. We always said it doesn't cover malaria. There's no vaccine against malaria. And where we sit today, it also does not cover COVID-19. It doesn't cover the SARS-CoV virus, and there is no vaccine available to protect us against this. However, we're going to go back to that one. I have to stress that malaria still kills. So just the other day, 17 July, 39-year-old lady, ill for 5 days, no prophylaxis, had been living in Lagos for years without prophylaxis. Presented to us by email and eventually by telephone with multi-organ failure, confused, jaundiced, anemic, short of breath. That's complicated malaria. It took 28 hours to get an air ambulance airborne because of the red tape, because of the lockdown measures in place. It's always been difficult to get an air ambulance up into Africa. It is much, much, much more difficult now. And so the message to all our travelers needs to be, don't get sick in the first place. So 28 hours to get the air ambulance airborne, another 12, 14 hours to get her down here. She spent a week in ICU in Johannesburg. She's now home in Cape Town. This is when she arrived. Afterwards, when I asked her permission to use the photo, she said she could vaguely recall meeting me, but she cannot recall that I took the photo at all. So although she appears to be conscious because she's got cerebral malaria, she actually doesn't remember the detail of this. She was the lucky person. In March this year, shortly after the lockdown measures started, we were involved in the repatriation and quarantining of 19 mining company expatriates coming back from the Copper Belt in Zambia, where they'd been for more than 3 months. So we did what is expected now, which is to quarantine them for 7 days. We did PCR tests on all of them, which came back negative. And then 2 weeks later, 2 of these men became ill in the Randfontein and Rustenburg, respectively. One guy in his 40s, the other one 54 years old. 2 of them became ill with malaria and only 1 survived. So while everybody was panicking about COVID, the impact it may have, the whole PCR issue, the issue about quarantining incoming travelers to try and avoid the spread of the disease, somebody dies from malaria. So malaria has not gone away, and let's please remember that. So to jump back to my previous slide, this is the coronavirus. You would all recognize it by now. And I got into a little bit of trouble when we distributed this infographic that starts by saying, burn your mask. what you had to do before you got hysterical and I had the WITS Ethics and Publication Committee on my neck is to read the next bit, which says, and be part of a possible solution. And this is really a call to action. Travel Doctor dares all healthy South Africans to take part in the trial. We are not just passive victims of this pandemic that has really wreaked havoc around the world. Simi mentioned Ebola just now. Ebola was nothing by comparison to this for a whole variety of reasons, which I won't discuss right now. But the bottom line is, until such time as we develop an effective vaccine, we are all going to run around like idiots with masks on our face. We're going to have to social distance. We're going to miss out on meeting with friends and family. We are not going to be able to travel for leisure of work without a massive amount of hindrances. So what we're asking you to do is take note of these URLs, copy them, and go and sign up. If you fit in well in any way, and even if you're not that fit in well, apply to be part of one of the vaccine trials that are happening. I'm just mentioning 2 here now, but we've got 3 vaccine trials ongoing in this country right now, run by top-class academics, part of international trials. We cannot expect to be part of the world population that will receive the vaccine if we don't take part in trying to develop an effective vaccine. My wife and I both signed up for the Oxford trial at Baragwana Hospital. Lovely people, all dedicated, very effective. The tragedy was the day we received our vaccines, the first vaccine, we also tested positive for the coronavirus. So we actually got the disease, not because of the vaccine, but because we'd already been infected, being healthcare professionals. We were lucky. We were unwell for 2 weeks. We didn't have to go to hospital, but it's not a pleasant thing to have, even if you don't end up in hospital. And so it would have been much better to have had a vaccine available. Right. So how do we navigate the new health regulations in the new world? Or how to travel and remain sane, or how to travel and remain almost sane. So as I mentioned before, international health management consultants involved in many places in Africa over many years. And because we wanted to rotate some of our own paramedics back out of West Africa, we started talking to a number of airlines, most of them grounded at that point in time. And this is how I ended up being able to take this photograph. And if you shop, then you'll see that SAF Air is on the departure board in Ghana, in Accra's airport, a rather nice, spanking new, clean, efficient airport, I may say. And this was because I went along as the medic on board for a repatriation flight, bringing mining company officials back from Ghana that had been stuck up there. And this is, obviously, we also flew people up. And that's how we got involved in the entire process, trying to spur on travel in the interest of everybody involved, and how we had the privilege of getting involved in a couple of these rotational flights. So at the moment, any flight that takes place across a border is called a repatriation flight. But that, in fact, is no longer really accurate, because people are traveling out as well. They're not all coming back. They're allowed to travel out. Initially, those flights flew out empty on our tax money very often, and came back with South Africans coming back home. And foreign airlines were allowed to take foreigners back to their countries, but not to bring South Africans in. These flights are now purely rotational flights, and in essence, they are charter flights arranged by the individual companies that want to rotate their staff. So the virus is here to stay. We're going to have to learn to live and travel with it. It may become less virulent or dangerous over many decades, many cycles. We may get some form of herd immunity when 60 to 80% of the population have actually had the virus, but that may come at the cost of a lot of lives lost in the process. And in the meanwhile, we hope and pray and take part in the vaccine trials to get an effective vaccine. Until then, leisure travel will be limited, travel for work will be cumbersome, and we're going to look a little bit at coming home and going to work. So Simi put quite a bit of emphasis on the quarantine process coming back, but I'm happy to report that things are really changing quickly. So the so-called repatriation flights are still a groot gemors. There's no other good way of saying that. It's a mess. They're irregular, they're expensive, they move dates, they get cancelled at the last minute when flights aren't full, And that's irrespective of whether it's a charter flight or a flight by a regular airline. I'm thinking about Emirates, Qatar, KLM, a few of the airlines that just kept on flying. And it is a major source of anxiety and stress for everybody involved, the travelers and I think the travel agents, because it's so unpredictable. And then if it is about coming home, you then have to quarantine. Now, before we move on to the next slide, the picture at the top there is OR Tambo Airport when we did one of the rotational flights, and you can see that there's sniffer dogs sniffing the luggage. So this is part of the circus of going, when you go out, is we've never had sniffer dogs before, but now for some other reason in an empty airport, we've got sniffer dogs. So when you come back home, you have to quarantine. And the rules are changing very quickly. And that's why I'm saying I'm glad to be able to say that we are actually moving on. So if you did not arrange private quarantine, up to now, you have to go into state quarantine. And state quarantine involved being picked up at the airport, being put on a bus, and being taken to a quarantine hotel, or in some cases, quarantine centers, hostels, that got a pretty bad reputation in the press very quickly. However, we have to say that many of the hotels that are being used for private quarantine are also being used as state quarantine. State quarantine implied that you had to stay in for 14 days, and there was no way out. That changed a couple of weeks ago when the government declared that you will now stay in state quarantine for 10 days, which is still a long time if you've been away from home for months and you're keen to get back to your loved ones or to get back to fix the swimming pool pump. We cannot arrange private PCR testing whether you are infected with the virus if you are in state quarantine. So the alternative is to this has been up to very recently to arrange for private quarantine in a designated hotel for which the traveler has to pay for himself. The process then would be that you arrive on day 0, you get picked up at the airport. I'll show you a little bit more about that just now. You arrive on day 0, you check into the hotel, and then on day 5 after your arrival, effectively day 6, we send out a laboratory team that will go and do a nasopharyngeal swab, and we will do a PCR, a polymerase chain reaction test, to see whether you are infected with the virus. If you are not, you would get released on day 6 typically. We've now got a very good turnaround. The laboratories are not overwhelmed. We're very grateful to say, because we've passed at least the first peak in the local pandemic. And you will then be released to quarantine at home to complete 14 days, or then in the case now, 10 days. I put home in hakkies down there because it is now also possible to apply for home quarantine to the South African government. You send an email to a specific email address 4 days prior to arrival, and you are then granted quarantine based on the fact that you've got a house with a private bathroom, that you don't share it with too many other people, that you've got your own bedroom, etc. There's no guarantee that this will be granted. One of the first reasons given initially that it wasn't granted was because somebody stayed more than 3 hours drive from OR Tambo Airport. So they were told they can't quarantine at home, and they then had to either go into state quarantine or pay for private quarantine. It seems to have changed, but it is still a little bit erratic. It's still a hit and miss situation on whether you are going to get allowed to go and quarantine at home or not. It may also be revoked by Port Health at the last minute. And we had an incident yesterday afternoon. I got contacted by a foundation that assists people with cancer. A gentleman flew in from Dallas in Texas in the United States via Amsterdam on KLM to Cape Town as a potential bone marrow donor for his brother with leukemia. And everything had been arranged. He'd been granted private quarantine at home, but when he got to Cape Town Airport, some overzealous Port Health Authority person grabbed him, put him in a quarantine bus, and sent him off to a state quarantine hotel. This is when we got involved, and with a little bit of luck, we managed to get him out because he had to get to a private hospital urgently today so that they can do tests on his bone marrow. And then permission may also arrive too late. So you send your email in 4 days before. If you send it in too long before, it just gets ignored. It doesn't help to apply 2 weeks before you come. So we would propose that if you are uncertain whether you're going to get granted a private quarantine at home, that you book private quarantine in a hotel as a backup. Up to a week or so ago, the hotels were happy to cancel the booking and refund you 100% if home quarantine was granted. But the hotels are becoming less keen to do that as more and more people do get private quarantine at home permission at the last minute, and they then cancel, and it becomes a huge accounting issue to refund everybody. So this is just an abstract from an email from a week or two ago. This was from somebody sending people back from the United Arab Emirates. And it was a bit of a complaint. He says, I wanted to share some feedback from our previous crew who had arranged your service. As soon as the plane landed in Joburg, all passengers had to exit the plane to go to immigration to get cleared and to go through a quick temperature check. Now, this is already a change. When I got back from Paris in March, just as the lockdown happened, we spent half an hour sitting on the plane waiting for somebody from Port Health to come on board and check everybody's temperatures. This now happens in the airport. After being cleared, they then proceeded to get into a minibus to go back to the plane to identify their luggage. So you go through immigration, then you get back on a bus and you go back to the airplane. You don't get your luggage in the normal luggage collection area. And they had to put all their luggage onto the bus, where there was not enough space for their luggage nor the passengers. During this process, our crew had made contact with Proud, the transport gentleman from the private test doctor. It's actually the private transport company. They were ready and waiting outside the main gate to pick up our crew. However, they were not allowed to go inside to wait for and do the pickup. The airport did not allow our crew to go to their private transfer, and they had to get in the minibus with the rest of the passengers. They were escorted to another accommodation, and when inquiring with the gentleman in charge at the airport, he informed our crew that they had no info regarding them. And this happens on a regular basis, in spite of the necessary permissions being granted by the Department of Works, because they're the people that do so, and in spite of the passenger having proof of his private quarantine in hand, depending on who you end up speaking to at the airport, this may be ignored. So our crew had asked the private transfer to follow them to the hotel. This is what they do as a rule, and everything went smoothly with the transfer, hotel, and all arrangements. To avoid any of this happening in the future with other crew, may we suggest that your company make arrangements with the airport to get permission for the driver or representative to enter the airport in order to be able to pick up the crew from the airport straight away. Now, the problem with this is we cannot get such permission simply because officially the international side of the airport is still closed. We've now got domestic flights, which we're all very grateful for, but the international side of the airport is officially closed. And that's why nothing is working the way it normally should work. So just to warn your travelers that in spite of the best arrangements made by yourself or somebody else, it could go awry because of the pandemonium at the airport. So that's for coming in. Now, if you want to go out to work, foreign travel currently is allowed only for work, medical reasons, and study. But people are traveling, and they're traveling in their droves. So what are the pitfalls? Some countries restrict entry from so-called high-risk countries. And because we've been doing a lot of testing, if you go and look at the Johns Hopkins map, etc., we're still one of the countries with one of the highest numbers of infections recorded. And we are responsible for at least 50% of the infections in Africa. But that's because we tested. We found people that were infected. But that does put us on a high-risk list. In terms of, for example, Europe, the Brits wouldn't allow us in there. The Swissies won't allow me back right now because we consider to be a high risk. But that's simply because we tested. Specific official documentation is required. So it's all the normal stuff, your visa, your passport, a valid passport. But then you also need a letter of appointment from the company that you're going to work for. And very often, certainly in the context of Africa, they want an additional letter to show that you've got permission to enter the country over and above your visa and over and above your letter of appointment. To exit South Africa, you then have to apply to Home Affairs. Now, this seems to be a little bit of a rubber stamp thing. So you have to supply all the proof that you are welcome in the country that you're going to. You've got to supply proof of the countries that you may be transiting to, a copy of your air ticket. And that could be a problem, because if you're going on one of these rotational charter flights, it's a chicken and egg situation. You cannot have an air ticket before you've got permission to travel, because they cannot apply for air clearances before they've got a complete passenger manifest. So they've got to be sure that they've got 60 passengers traveling and supply those names. Before they've got that, they can't issue a ticket. So this sometimes causes a lot of confusion and anxiety as well. And then more and more now, you have to have proof of a negative coronavirus PCR test. And that is time limited. And I'll say a little bit more about that. In some cases, some countries, we dealt with somebody going to Morocco, for example, would also require proof of a negative antibody test. And the reason I put that in a different color is because antibody tests up to 2 weeks ago were not available in this country at all. And it's an extremely controversial a controversial test in the context of the clinical setting, of whether people are sick or not. So it's got a different role here, but not a very useful role. I'll show that to you in a moment as well. So the proof of a negative PCR test is becoming more and more general. And I'm just showing you here KLM travel clinics at Amsterdam Airport are, for example, offering this service. The little poster on the right-hand side from TMB, that's an island-based travel clinic group. And because the airlines very often, rather than the countries that the person is going to, are requiring these tests, we are now beginning to offer them. So that's not just for sick people. Now, it's important to stress that you cannot get a routine PCR test from the state, and private laboratories overall, up to very recently, were reluctant to test you unless you were symptomatic, because they were overwhelmed by actual sick people. Your medical aid will not pay for this test, and you usually need a doctor's request in order to get one. And if you do not arrange it specifically with the laboratory or the doctor to say that this is for travel and it's got to be, the result has to be available in a certain time restriction, you may have a delay in receiving your results, which may mean that you cannot fly because you don't have proof that you are PCR negative. So this slide, I'm just wondering about time a little bit, but this slide is just to show you on the left-hand side there, look at the top bar, before symptom onset and after symptom onset. That is if you become symptomatic, because we know that approximately 50% of people that become infected with this virus are not symptomatic. They're not sick, but they do spread the virus to other people. And that's why, from a public health point of view, we want to prevent people that are harboring the virus and shedding the virus to get into contact with other people, and certainly to travel on an aeroplane full of people, and also to get into another country and maybe spread the virus back into an area that has seen that peak before. So in the week before symptom onset, if you are going to get symptoms, I'm going to move on to the next slide. That's the light gray area there. You can see that your PCR starts becoming positive a week or so before you become ill, probably only in the last 2 or 3 days. At this point, you are already shedding virus to other people, and you keep on being infective. Look at the bottom bar, the infection potential, for up to 2 weeks after you were symptomatic, but mostly in the first 5 to 6 days after symptom onset. Again, our problem with travelers is that they may not be symptomatic, and so they are not sick, but the airline or the country they're going to wants to know that they are negative. So your PCR will become positive in the few days before you become sick, if you become sick, and it'll stay positive for approximately 2 weeks, maybe up to 3 weeks after you became symptomatic, or for 2 to 3 weeks if you're an asymptomatic carrier of the virus. If you look at the beginning of the second week there, then you see the antibodies start becoming positive. First, the purple line, IgM, that shows normally you are infected now, and then your IgG antibody is your body's long-term response and what may make you immune in future against this coronavirus. but we do not have scientific evidence yet that that is the case, and not all IgG positive tests are a guarantee that you've got the right antibodies that will neutralize the virus and prevent you becoming infected again. So this is why you need a PCR and not an antibody test. An antibody test is too late to show acute infection and acute illness and the fact that you are actually shedding the virus. And there are only specific situations in which the antibody test may be useful. So that's just to show you if we, as we move on, how it changes. So we can arrange a PCR for travel purposes. The country or airline requirements differ. Usually the airlines want to see a test that is less than 72 hours old, approximately 3 days. Some of them are saying 96 hours, which probably still makes clinical sense if you think back to that graph that I've shown you. I know of 2 countries in Africa that we deal with a lot. So Guinea is happy with a test that's as old as 7 days, and Zambia says the test can be as old as 14 days. But that's a little bit of a joke, because you can become infected. You can have a test today and you can become infected in 7 days' time. And by the time you go to Zambia, you are actually infected and shedding the virus. So a safe time, a sensible time is more 72 hours. But remember that a negative PCR, up to 30% of PCRs are false negative. It's not 100% guarantee that you are not infected with the virus. You could still potentially be infected. And as happens in the expats that go back to West Africa, on arrival, they get tested again. And you need to warn your traveler that they may be found to be positive when they get there. And so they may still end up in quarantine in the host country that they are going to. Here's just a link. You can send an email if you're interested in one of these tests. You can send a link to Let's Fly at travel.corp.com. Or if you click on the screen now on the QR code, your cell phone should take you to a little program where you can do these, where you can get this done. So that's just more about the antibody test. I mentioned Morocco. There is now an official antibody test available in South Africa. The finger prick test, the so-called point of care test, is unreliable and should not be used at all, even though it is available, can be bought. Doctors can administer it in their clinics. It potentially shows past infection, not currently infected. We told you that. So if there's a real need, a real indication for an antibody test, it should be done by a laboratory on a proper test bed. If we get a request for an antibody test and it cannot be provided, we will provide the traveler with an official letter to the effect. That's what we did with this lady going to Morocco. And that's my entire story for now. We'll be happy to take questions. Our contact details at the top if you want to send us perhaps some questions afterwards, or if you want to phone. And that's back to Simi then. Thank you very, very much. And thank you very much to TIC for the opportunity. Being in my study is not half as much fun as it was traveling with Simi and Karen around the country. And hopefully we can do that next year again.
Definitely, we'd love to do that. Albie, we do have a few questions that have come up. More often than once we've had, can we have the email address to apply for home quarantine?
I don't have that right on hand with now. I actually thought about that. If you give me a second, I might be able to provide it. I'll just tell it verbally.
Okay,
or
we'll come back to that. We'll come back to that. Another attendee said, if clients don't reside in either Gauteng or Western Cape, is home quarantine not an option?
It wasn't initially because of the 3-hour rule, but we had one of our paramedics who lives in Bloemfontein who came back, and he was allowed to stay over one night and then travel down to Bloemfontein the next day. So I think the quarantine regulations are being relaxed for a whole number of reasons. But this is where the difficulty comes in now with, do you have to book private hotel quarantine if you live far away from the airport, from Joburg or Cape Town airport? Or can you? I would say nowadays it is always worthwhile trying to apply for home quarantine in the first place.
Okay.
And then just to mention that some people actually prefer, we've got 2 clients now that want to quarantine in a hotel because they've got vulnerable people at home. They've got elderly people, or they've got people with comorbidities that put them at risk. And they are concerned because they're coming from a high-risk area, from the United States, for example. They are concerned about going home, and they prefer to quarantine in a hotel and get tested first.
Okay. One of the other questions, and this is a question that I've always been interested in, is what are the chances of getting the virus more than once, Doctor?
We don't know. That's the short academic answer. We actually don't know. We know that with the original SARS virus and the MERS virus, the reason it didn't end up in the situation where we now is because, you know, it's not exactly the same virus, and there is some immunity that has developed against that. People didn't get reinfected again. There are some anecdotal stories now. About a week ago, it was in the press. There's a man in Hong Kong that had proven COVID in March this year. He got tested again now because they're now testing everybody going through Hong Kong airport very efficiently, as they are in Hong Kong. And he was proven to have been infected again, but with a different virus. They can actually show it's not the same virus he had in March. So this is not an ongoing infection, it's a new one. However, the important thing as far as I'm concerned is it was on routine screening that they picked it up. He's not sick, he's asymptomatic. So it may be, he was clinically ill in March, it may be that his antibodies are giving him some protection. But one case, as we say, one swallow doesn't make a summer. One case doesn't mean that everybody getting it a second time is going to be asymptomatic. We just don't know.
Okay. A couple of the attendees have posted an email address for the self-quarantine, and it's quarantine@health.gov.za. Does that sound familiar, Doctor?
We've got a different one. We've got quarantine.
You want to do self-isolation?
We've got
Yes.
quarantine. Can I speak?
Yes.
Okay. Quarantine@health, PMO, Papa Mike Oscar.co.za.
Okay.
So it's quarantine@health, PMO.co.za.
Okay. All right. The alternate that some of our members are posting is quarantine at health.gov.za. Okay. And then we've got someone asked, traveling between Namibia and South Africa, will it be the same process?
I haven't dealt with a case recently that traveled by road, but I know of cases that were allowed across the border, but they then had to quarantine in Uppington, okay, coming back from Namibia. That's driving. We had a 92-year-old gentleman who went to visit his daughter on a farm in Grootfontein, and he was desperate to come back home to Mossel Bay. And the way we got him back was to fly him from Windhoek to Cape Town. We then put him in quarantine in a hotel. The daughter from Mossel Bay came in. We tested her beforehand to make sure that she's PCR negative. So they then both booked into the quarantine hotel. And on medical grounds, rather than wait 5 days to test, so he was elderly and vulnerable, we tested him the day after he arrived. And with his negative test, he could go home. And we do the same thing for valid clinical reasons. The gentleman who came in now to donate bone marrow to his brother, if he wasn't granted home quarantine, which he was initially, then he was grabbed and put into the quarantine hotel, but we got him out. But if we have somebody that comes in, we had a previous patient from Angola coming for chemotherapy for leukemia. They get tested the day after they arrive. The test is negative. We allow them to go. They are allowed to go.
Okay. One of the questions was, with people traveling in such a now I've lost it. In such a confined space in an aircraft, is it possible to get coronavirus through the air system of the plane and not only from another person in close proximity?
Okay, that's a good question. And it's got a good answer, because there's been a couple of articles now that have shown that air travel is not a particular risk. Okay, there've been very well documented cases where, I'm speaking off the top of my head, the 12 people on a plane from Pakistan to, I think it was Hong Kong, off the top of my head, the 12 people that were shown to be positive when they arrived in Hong Kong, they were PCR positive, they were infected, some of them were slightly symptomatic. Nobody else on that aeroplane actually got it. And that is because of the way the circulation of the air circulation works in the aircraft. The fresh air comes in at the top and it gets sucked out through vents at floor level. And the air conditioning system is built with HEPA filters in that are micro filters that take out even viruses. And so air travel seems not to be a particular big risk.
Okay. Next one, my client got approval a week in advance to self-quarantine at home. He's due to arrive this Saturday. Is he likely to have a problem?
If he has, we can't guarantee, but the fact that he got it more than a week before, that's great, because up to now we've seen people being ignored. Because they're diligent, they try and do it beforehand. They start 2 weeks ahead, they just get no reply. In this case, if he got his reply, that's fine. But I would keep a paper copy in my hand and shove it under anybody's nose that asks. We've also had 2 cases of people simply walking out of the airport. Now, previously that wasn't possible at all. If you come in at international arrivals, you get put on a bus. You can't just walk out of the airport building, but that seems to be changing as well. And that's part of the challenge of where we are right now. Everything changes every day, and some of the rules are unwritten and applied in different ways.
Okay, and Dr. Albie, when you private quarantine, where do they fetch you from? Are you fetched from the airport?
Well, that's the email I read you just now. So historically, a few months ago, if we arranged private quarantine, the private bus would be arranged, and they would meet you in the airport, and they would take you to the airport, to the quarantine hotel, to the private quarantine hotel. They then stopped that and insisted that everybody go on a state quarantine bus. And that's why, if you remember the email, the private bus drivers, you have to have the contact number and the name of your private bus driver. You then inform him that you've been put on a quarantine bus. The people on the quarantine bus normally don't know where they're going. The private driver will then follow the state quarantine bus until you get to wherever they're taking the people in state quarantine, and you will then be allowed to get onto the bus and be taken to your correct hospital, your correct hotel. So I had friends returning from New Zealand. They were booked into a hotel in Johannesburg. They were simply put onto a quarantine bus and they were taken to the St. George's Hotel in Pretoria. The bus driver followed them, and 4 hours after they landed, they eventually got to the hotel in Sandton. And it's good to tell your client that that's what's going to happen, because otherwise they're upset with you or with the driver and says, you know, he's not doing his job. But that's the way the airport works for now.
Okay, and then Nolene, hello Nolene, says that I've heard that the antibody tests are not accurate. Is that true?
Yes, that's what I said in my slide, that the antibody tests are not accurate because they made of, the quality isn't always the same. There are dozens of them made. And so the sensitivity and specificity isn't always good. And they're also inaccurate in terms of determining whether somebody is sick now, because remember, they only start becoming positive about 2 weeks after you were infected.
Okay. One of our attendees is asking if a person has an immunodeficiency comorbidity which reflects with low LGG and low LGM counts as their normal, how would this affect traveling? Could they travel?
Sorry, so let me just repeat that again.
Yeah, I'm not, okay, so it's just popped off the screen now.
It's somebody with low immunity. That's the message I'm getting. And then I think what floored me was the LGM, and it's IgG and IgM, I think.
Okay,
So,
all right. It's like an L to me.
Yeah.
Okay.
So if they are immune compromised, and whether it's somebody that's HIV positive or somebody on chemotherapy or somebody with an inherent, a congenital immune deficiency, they are at increased risk of getting the coronavirus. So I would be extremely careful, as they should be more careful at home, because they fall in the comorbidity vulnerable community category. I would be very careful to travel to an area where there's a known high risk of coronavirus.
Okay. Cheryl Shaw is asking, I'm busy bringing in patients from Zambia and Nigeria to South Africa for cancer treatment. Do I need to apply to DIRCO for permission for them to travel? Is there a specific form that needs to be used for that? Or is it just a matter of emailing DIRCO? Also, if I book them into a hotel for quarantine, how do we prove that he has been booked for the quarantine? It's quite a few questions, Albie, so I might have to go back for you. Do I also need to arrange for the PCR test to be done at the hotel, or does the hotel arrange that for us?
True, that is a backfall.
Okay. So let me go back to the beginning. Do I need to apply to DIRCO for permission?
Yeah, so DIRCO has to give permission still for all travelers into South Africa. So part of the flight on which they come, if it's a charter flight, the charter operator needs to get a list of all the passengers coming, and all the passengers have got to provide proof that they've been okayed by DIRCO to come. If they are coming on, for example, Ethiopian Airlines, that seems to do these repatriation flights on a regular basis, but effectively they are unscheduled regular Ethiopian flights, Air Ethiopian flights, they still need to apply to DIRCO for permission to come in. If they're foreigners, it may be a little bit more tricky. They're certainly going to need proof that they're coming for medical treatment and that it's urgent. So you would have DIRCO permission then for them to be on the flight. Otherwise, they won't be put on the manifest. Once they're on the flight manifest, you will then need to apply for private quarantine for them at a private hotel, because they can't come to, they're not coming home, okay? So that you need to book a private quarantine hotel. If you book, and only some hotels are designated as such, if you then book that, then if we're involved, we will arrange for the PCR. If there are good medical grounds, as I said earlier on, normally you have to wait to day 5 to do the PCR. If there's an urgent medical reason, urgent medical treatment, then we can arrange to do the PCR on the first day after they've arrived. And with a negative test, they can go, they then can go out. If it is very, very urgent, we had a patient with a brain tumor that came in on a regular flight, and he had a brain tumor before this was a recurrence, and basically he needed to go straight from the airport to the hospital. That can also be arranged. That is not done by DIRCO. The Department of Works, not the Department of Health, not DIRCO, not Home Affairs. The Department of Works gives permission for people to be released from quarantine, or to do private quarantine in a hotel. So okay, maybe the person should contact us, and we can assist with that, because it's a little bit complex. It involves different departments.
We've got so many questions. I'm going to ask one more, and then everybody will reply separately after the session. Last one for the day. I have a guy coming back from DRC tomorrow, and I've applied for self-quarantine, but have not had any feedback from the government. He's very ill with food poisoning. Will we be able to get him out of quarantine and get him to medical attention?
It's a tricky one, Simi, because no, if he hasn't got his permission yet, then he's probably going to end up in state quarantine. And no, it'll be very difficult to get him out of state quarantine unless he's obviously ill. Urgently coming back with food poisoning on a regular flight doesn't sound that ill to me. So it may be difficult proving in his case that he's ill enough to have to go to hospital, because if he's that ill, he should be on a medevac.
Okay. Someone wanted to know if TIC had a COVID case. We actually had a COVID case at the end of March, right at the end of March, just as we went into lockdown. When we were all going through that tumble dryer. It was a 71-year-old male in Germany. He presented with difficulty in breathing and was immediately admitted to a medical facility in ICU. He tested positive for COVID with severe pneumonia, and he was kept ventilated for over 2 months, Albie, before we could bring him back. His last COVID test was done at the end of April, and he was declared fit to fly by air ambulance, and the process was initiated. He came back home and went straight to a medical facility. Unfortunately, we were then informed that he passed away a few days later. But that's it from us today. We will get back to you on all your questions. Thank you so much for joining us, one and all. Thank you so much, Dr. De Frey, for being such a good friend and partner to us, and for always being so willing to share your interesting adventures with us. Thanks to everyone meeting with us today, and a shout out to CN and CO for hosting this event today. Wishing everybody a fabulous spring.